welcome back to oral pathology sessions. We are discussing about salivary gland tumors. Okay, we are starting with our malignant salivary gland tumors. First, we will be discussing about Mucoepidermoid Carcinoma. That is the most common malignant salivary gland tumor in both major and the minor salivary glands. Okay, let's see what is there in a Mucoepidermoid Carcinoma. Okay, you are seeing in this picture, you are seeing a swelling on the palatal region which is having some discolorations and all. Okay, so it is a swelling, it is present as a swelling. Now by this picture you come to know that these lesions are presented as swellings. Okay, now let's see, as we always begin, we begin with the table of contents. Okay, you will see the introduction, the etiology, the clinical features, histology, and a grading of a tumor and the treatment. Okay, that's all the headings we should discuss a mucoepidermoid carcinoma. The most important one is your histopathological features, okay, and the grading. Okay. Now let's see mucoepidermoid carcinoma. We know that it is mucoepidermoid. Okay, I have told you that always pathology will explain itself. Okay, from the name itself you will get a clue that what it is. Okay, something muco and something epidermoid means something like a mucus and something like a epidermal cells or squamous cells. Okay, so epidermal like cells and the mucus like. Okay, so there is two things here. Okay, that's the clue we get. Now let's see what is there in mucoepidermoid carcinoma. Okay, it is the most common salivary gland malignancy that we have already discussed when we have discussed in the basics of salivary gland tumor video. Okay, we have discussed that mucoepidermoid carcinoma is the most common salivary gland tumor, either in the major as well as in the minor. In the children also, most common malignant tumor is here mucoepidermoid carcinoma. Okay, both in adult and children, and you can see in this clinical picture that okay, it is very large obvious swelling. Okay, so the gene mutated here in mucoepidermoid carcinoma is MAML2. Okay, so if you remember the just to remember the name, you can write that MAML2 gene. Okay, mucoepidermoid carcinoma M4M. Okay, M4M, your MAML2 gene can be mutated. It was PLAG1, P4P, PLAG1 pleomorphic adenoma, and mucoepidermoid carcinoma MAML2. Okay, remember like that. Now let's see the clinical features. What are the things you see in mucoepidermoid carcinoma? It is the most common malignant salivary gland tumor. It most common malignant salivary gland tumor in children also, in adult also, and where it usually occurs, it is mostly occurring on the parotid gland. Okay, and it is also presented as a symptomatic swelling, but as the lesion grows, the malignant tumors initially they always present as an asymptomatic lesion, but as the lesion grows it will produce symptoms like it can produce pain, it can infiltrate or compress the nerve and cause neural features or neural, what we can compress the facial nerve. What happens when the facial nerve is compressed? It can lead to a transient palsy, facial palsy. Why? The nerve is blocked or nerve is compressed by this tumor. Okay, at mucoepidermoid carcinoma occurring in the parotid gland, you know that the facial nerve passes through the parotid gland. So when the tumor develops, it can press the or compress the facial nerve, the patient develop a palsy. Okay, so it is initially asymptomatic, but it can cause symptoms like pain, facial nerve palsy, and mostly if you take a minor salivary gland, it occurs in the palate region. Okay, these are the basic things you should know about mucoepidermoid carcinoma. Now let's see the histopathological feature. Okay, histopathology, how we are going to learn the histopathology? We are going to learn histopathology in three things. Okay, you are going to see the cell type, you are going to see the architecture, and you are going to see the stroma. So always try to study a tumor in these three parameters. Only these three components are there in a tumor. If you know what is a cell, how it is arranged, and how the stroma, surrounding stroma is, enough. You are completely explaining a tumor, nothing more than that. Okay, you will get score maximum marks. The examiner knows that okay, this child knows it very well. Okay, so cell type, what kind of cell? As the name indicates, we are seeing mucoepidermoid. We are seeing mucus cells and epidermoid cells. Okay, so we are seeing two types of cells here. We are seeing mucus cells and epidermoid cells. Okay, So let's see what's there in mucous cells. Okay, the mucous cells, these are the mucous cells. Can you see in this picture? What are mucous cells? They are mucus producing cells. They are mucus producing cells. See here, they are very clear cytoplasm. They have a very clear cytoplasm. Mucous cells, they have clear cytoplasm. Okay, because it is filled with mucus. Okay, mucins, they produce mucins, so they can be stained by uh, what mucin stains. Okay, your mucin stain, special stains for mucin, your mucicarmin stain. Okay, the special stain for mucin, that is mucicarmin. These stains can stain these cells. Okay, in HNE it will appear clear cells because it is mucin. It will appear like this. Okay, very clear cells, right? Light pink, very light pink. They are nothing but mucous cells. So that is one type of cell. What is the next type of cell? Epidermoid cells. Epidermoid cells are these. Epidermoid cells are nothing but just looking like your squamous cell, your epidermal cells. Okay, they are polygonal cells. Okay, they are polygonal cells like this. And mucous cells, they are look like this. Okay, with basally placed nucleus and clear cytoplasm. Okay, like this. They are mucous cells, and you can see epidermoid cells like this. Okay, they are having polygonal cells with large nuclei. Okay, vesicular nuclei. They are polygonal cells. These are the two types of cells you can see in mucoepidermoid carcinoma. Mucoepidermoid carcinoma. So mucus and epiderm. Now there is interesting, a small percentage of a cell is seen which is neither mucus nor epidermal. They are called intermediate cells. Okay, they are small cells with dark large nuclei. Okay, they are small baseloid cells. Okay, and they have scant eosinophilic cytoplasm and dark nucleus. Okay, dark nucleus. They are small round cells. They are called intermediate cells. Okay, so these are the cell types in mucoepidermoid carcinoma: mucus, epidermoid, and intermediate. Okay, now the cell type is over. Now let's see the architecture. Now in this picture you can see they are arranged in cystic as well as sheets. Okay, here you can see, here you are seeing sheets of epidermoid cells, and here you are seeing large cavities, large cystic spaces. I have told you it is not cyst, cystic. Okay, cystic means cyst-like. Okay, cyst-like spaces. Okay, you are seeing cyst-like spaces, and what is inside the cyst-like spaces? They are mucin filled spaces. So that is the architecture. The epidermoid cells are seen in sheets, while the mucous cells are around cystic spaces. Okay, and these spaces are filled with mucin. So this is how it is arranged. Now you know the architecture. You know the cells, mucus, epidermoid, and intermediate. Now how it is arranged? The in epidermoid cells and intermediate cells, they are in sheets. Where are these mucous cells? They are arranged around a cystic space, and within the space there is mucus. Got it? Now let's see the stroma here. Can you see the stroma? Stroma is nothing but your what? Collagen, fibrocollagenous stroma. Okay, the stroma has no much features. Okay, stroma is just fibers. Okay, collagen fibers. Okay, this is what you see in mucoepidermoid carcinoma. Okay, you are seeing the cell type, architecture, and the stroma. Now you see a grading of this tumor. How this tumor can be graded? How mucoepidermoid carcinoma is graded? The mucoepidermoid carcinoma is graded on the presence of the structures we have learned. Okay, the amount of cyst. How much area is cystic? Okay, how much amount of mucus and epidermoid cells are there, and how much degree of cytological atypia is there, means how pleomorphic they are or how the cells are. If the cells are so atypical, means there is what, more malignancy, right? Cytological atypia, dysplasia. Okay, tissue dysplasia, cytological atypia. Okay, your first classes of your epithelial tumors, do you remember? Okay, the cytological atypia, tissue dysplasia are features of what, malignancy or towards malignancy. So how much amount of cystic areas are there? If cystic areas are more, less what grade? Okay, low grade. More number of sheets of tumor, high grade. Cystic areas are more, sheets are less, low grade. Cystic areas are less, more tumor sheets, high grade. Okay, so that's how. More cystic, less grade. Okay, more sheets of epidermoid cells. Okay, high grade. More, okay, high grade. And more atypia, high grade. Okay, so let's see. So low grade means that there is prominent cystic areas, minimal cellular atypia, and more mucous cells, less epidermoid cells. Okay, so this is low grade tumor. Okay, a tumor with more amount of cystic areas, more mucous cells, and less cellular atypia and less epidermoid cells. It is called a low grade tumor. And see, high grade tumor, you are seeing cystic areas are very less, only solid sheets of squamous cells. There is no cystic areas. Cystic areas are very less. You are seeing sheets of tumor cells. That is high grade, right? More cells. Now there is severe pleomorphism, severe cellular atypia, and very less or very absent mucous cells. Okay, so it is high grade. And what comes in between is intermediate grade. Okay, this is how we grade. So more cystic area, more mucous cells, low grade. Okay, lower the grade. Now there are few techniques or few classifications or few grading systems. That first one is the Auclair grading system. Okay, in here we know that what are the things they use to grade. They use the cystic component, the intracystic component, neural invasion, necrosis, the mitotic figures, and anaplasia. These are the features they have taken to grade a tumor. Okay, how much the cystic component is. Auclair has taken cystic component, how much the cystic component is, and they give a point. Okay, they give a value. If the cystic component is less than 2 and more amount of sheets are there, they give a value of 2. And if it is showing neural invasion, you know, malignancy, so neural invasion, they give a 2 point. Okay, if necrosis there, if they give a point. If it is not there, they give 0. So, and finally they count the score, total score. If the total score is between 4, it is low grade. If it is 5 to 6, it is intermediate, and it is more than 7, it is high grade. So this is a method of scoring. You should know at least the Auclair grading. Name of at least one grading you should know. You should remember the Auclair grading. The main thing you should remember is that to classify or grade a tumor, what they are seeing is they are seeing the cystic component. Okay, they are seeing the how much mucous cells are there. Okay, how much amount of epidermoid cells are there, how much pleomorphism is there. Okay, neural invasion, necrosis, all these factors are seen. Okay, now other one is the Brandwein. Okay, they are also using the same component, the intracystic component, the tumor invasion, the nuclear atypia, the bony invasion. So all these features, neural invasions, necrosis. Okay, either it's the Brandwein or the Auclair. You should learn one of the grading criteria of mucoepidermoid carcinoma. Now come to the treatment of mucoepidermoid carcinoma. It's a malignant tumor, so surgical excision is done. Okay, and after the surgical excision, if you try to preserve the facial nerve as much as possible. We are trying to preserve the facial nerve, but if there is neural invasion, if the tumor is involving the nerve, then the facial nerve is also sacrificed. Okay, so advanced tumors where you are seeing the neural invasion, the tumor has invaded the nerve. Okay, then you remove the facial nerve also. And after surgical excision, as it is a malignant tumor, you can give a radiation therapy. Okay, and the prognosis depend on the grade. Okay, which grade has good prognosis? Low grade tumors will be having good prognosis, while high grade tumor will be having very bad prognosis. Okay, so this is how you should learn mucoepidermoid carcinoma. Okay, so from the introduction, the genetic reason. Okay, MAM-L2 gene, M for M, mucoepidermoid, MAM-L2, the clinical features, the histological features, the grade. Histological features, you should know the cell type, the mucous, epidermoid, and the intermediate cell. The architecture, sheets of epidermoid and cystic areas with mucin. Okay, and about the stroma, which is a fibrocollagenous stroma. Coming to its treatment and grading. Okay, grading very important. How it is graded into low grade, high grade and intermediate grade. Okay, and what are the name two parameters or name two grading systems, the Oclear grading or the Brandwein grading. Okay, doesn't need to by heart it, at least one you should remember the Oclear grading. Okay, and the treatment option. So this is how you should present or arrive about mucoepidermoid carcinoma. Thank you.